Hi guys, this is RN Daily Dose, formerly as Inday RN, and here I am to give you some helpful tips to maximize your study for the exam. And before we're going to start, please don't forget to click like, comment, and subscribe on my channel, especially if you are new.
(21) Two nurses are performing CPR on an adult. The nurse performing chest compressions is on the right side of the client, and the nurse performing rescue breathing is on the left. The nurse performing rescue breathing checks the client's pulse to determine if the nurse's compressions are perfusing. Place an X at the location where the nurse should check the client's pulse. (22) Members of a resuscitation team arrive at the client's bedside with a defibrillator. The nurse and an RN are performing CPR. What should be the nurse's next action? (23) The nurse applies AED pads to the client's chest, and a shock is advised. What should be the nurse's next action? (24) When placing defibrillator pads on the client, the nurse observes that the client possibly has an implanted pacemaker on the left upper chest. Which statement demonstrates that the nurse knows where to correctly place the defibrillator pad? (25) While jogging, the nurse finds an adult lying on the ground. The nurse uses both tactile and verbal stimulation to determine that the client is unresponsive. What action should the nurse perform next? (26) The nurse is teaching rescue breathing to the daughter of an adult client. Which statement indicates that the client understands how to perform rescue breathing? (27) The nurse finds an unresponsive, pulseless client lying in a puddle of water in a shower. The resuscitation team would like to attach the AED to the client immediately. What intervention should the nurse implement first? 28. The home health nurse finds an adult client unresponsive and considers cardiopulmonary arrest. Which actions should the nurse perform? Select all that apply. (29) The nurse is providing post-resuscitation care to the client. The client's HR is 80 bpm, and the RR is 14 breaths per minute and regular. Which action should the nurse perform next? (30) The nurse enters the client's room and notes the client in the position illustrated. Which action should be taken by the nurse?